Assalamualaikum and good afternoon everyone. Today I'm going to present about infection control for hepatitis B patient. What is hepatitis B? Hepatitis B is a serious infection of your liver caused by hepatitis B virus, a small virus carrying DNA of the hepatadenovirus family. Chronic hepatitis B can increase the risk of developing liver failure, liver cancer, or cirrhosis, a condition that permanently scars your liver. HBV is 100 times more dangerous than HIV. How do it infect others? From blood, mother to child during birth, household contact, sharing hygiene equipment like shaver, unsterile healthcare practice, tattoos, virgin barbers, scarification, circumcision practice, and sharing needles. From sex, sexual transmission. Symptoms. Signs and symptoms of hepatitis B range from mild to severe. They usually appear about 1 to 4 months after being infected. Hepatitis B signs and symptoms may include dark urine, fever, joint pain, loss of appetite, nausea and vomiting, weakness and fatigue. Infection control in operating theater. Infection control interventions are important to prevent surgery-related infection. Infections can develop in healthcare facilities through equipment, object, patient, and staff. Effective infection control is used to identify, control, and prevent infection. In order to protect ourselves, we need to wear personal protective equipment, aka PPE. Infection control policy. The major aim of this policy is to minimize the risk of infection through the appropriate and timely isolation of the patient. Infection prevention and control practices are provided to effectively identify, control, and prevent the spread of infections. Standard precaution. Hand hygiene. Hand hygiene is the #1 weapon in preventing the spread of microorganisms and viruses like hepatitis B virus and coronavirus, and it includes alcohol-based hand rub and hand washing with soap and water. Alcohol-based hand rub contain 60 to 95% alcohol are the preferred method for decontaminating hand. Hand hygiene should be performed before and after the contact with patient, and immediately after touching body blood, body fluids, or contaminated item, because this is how hepatitis B virus can spread. Personal protective equipment, aka PPE. PPE includes gloves, gown, masks, respirators, and eyewear that create barriers to protect skin, clothing, and the respiratory system from infectious organisms. Gloves should be worn when touching blood, body fluids, non-intact skin, and contaminated items. Face shield or mask should be worn if we anticipate a splash or spray of blood or body fluids that might come in contact with our nose, eye, or mouth. Wear gown if we expect our skin or clothing might be exposed to body fluids or blood. By knowing how to put on and remove the PPE can help us to prevent cross-contamination. Injection safety. Gloves should be used when administering injection. Puncture-proof disposable systems are recommended to dispose the uncapped needles and sharp. Never recap needles to reduce the risk of being stuck with unclean needle. Environmental cleaning. Environmental cleaning includes medical equipment and environmental surface. Any renewable equipment like stethoscope, that used on a multiple patient must be cleaned between each patient contact. Chlorhexidine can be used as an antimicrobial agent to disinfect hard surface equipment. Respiratory hygiene. Respiratory hygiene and cough etiquette are infection control measures that should be implemented when contact is made with a patient who might have an upper respiratory infection. Patients with signs and symptoms of a respiratory infection should be taught to cover their mouth and nose with a tissue when coughing or sneezing and throw away the tissue in the nearest trash container. This patient should perform hand hygiene after being exposed to respiratory secretion. Conclusion. In conclusion, we need to always apply standard precaution when handling patients with infectious disease to help reduce the risk of infection. Always hand hygiene before and after the contact with patients. Use PPE when handling patients with infectious disease. Never recap the needles after giving injection. Always clean the medical equipment and surface after use, and cover your mouth and nose when coughing or sneezing. Thank you guys for listening me babbling. See you when I see you.